Everyone, welcome back to my YouTube channel. In this video we are discussing about glomerular filtration rate, which is GFR. The GFR provides a useful index of overall renal function. GFR जो overall renal functions है उनका index provide करेगा, measure करेगा amount of plasma unfiltrated across the glomerular capillaries and correlate well with the ability of the kidney to filter fluid and various substances. अब easily जो है देखिएगा कि किडनी की कैपेबिलिटी कि किस तरह से वो फिल्टर कर रही है फ्लूइड को और दूसरे सब्सटेंस को जो रिलीज़ करने थे. GFR रेंज अगर डेली बेसिस पे देखें तो 100 से 120 ml पर मिनट है. लो GFR इज़ एन एविडेंस ऑफ द सीरियस प्रोग्रेसिव रीनल डिजीज एंड इंडिकेट अ डिक्रीज इन द टोटल फंक्शन renal mass. The GFR reduce in both acute and the chronic renal failure. अब one method of determining the GFR from the creatinine is to collect the urine to determine the amount of creatinine that was removed from the blood over a given time interval. If one removes say 1440 mg in 24 hours, this is equivalent to removing 1 mg per minute. If the blood concentration is 0.01 milligram per milliliter, then one can say that 100 milliliter per minute of the blood is being cleared of creatinine. Since to get 1 mg of creatinine, 100 ml of the blood containing 0.01 milligram per milliliter would need to have been cleared. Creatinine clearance, which is known as CR, is calculated from the creatinine concentration in the collected urine sample, urine flow rate and the plasma concentration as you seen in the formula. CCT is equal to UCT multiplied by V and divided by PCT. CCR creatinine clearance, UCR urinary creatinine mg per deciliter, PCR plasma creatinine, V यूरिन फ्लो रेट मिलीलीटर पर मिनट. अब इसमें क्या है हमारे पास क्रिएटिनिन क्लियरेंस इज इक्वल टू यूरिनरी क्रिएटिनिन मल्टीप्लाई बाय यूरिन फ्लो रेट डिवाइडेड बाय प्लाज्मा क्रिएटिनिन. तो इस तरह से ये है बेसिकली इसका फॉर्मूला. Decreased GFR manifest as the raised serum urea and creatinine. However, the serum urea and creatinine are not elevated above the normal range until there is a reduction of the 50 to 60% in the GFR. Therefore, it should be noted that normal urea and creatinine level do not rule out renal insufficiency, and women's serum urea and creatinine begin to rise more than 50 to 60% of the renal damage has occurred. उसके बाद हमारे पास आ जाता है एस्टिमेटेड क्रिएटिनिन क्लियरेंस. A number of formula have been devised to estimate GFR or CR values on the basis of the serum creatinine levels. Estimated creatinine clearance rate using Cockcroft-Gault formula. A commonly used surrogate marker for the estimate of the creatinine clearance is Cockcroft-Gault formula, which in turn estimate the GFR in milliliter per minute. It is named after the scientists who first published the formula, and it employs serum creatinine measurements and a patient's weight to predict the creatinine clearance. The formula as originally published is यहाँ पर आपको शो रहा है. ये फार्मूला है हमारा 140 माइनस एज मल्टीप्लाई बाय मैस इन किलोग्राम मल्टीप्लाई बाय 0.85 इफ फीमेल डिवाइडेड बाय 72 मल्टीप्लाई बाय सीरम क्रिएटिनिन. दिस फार्मूला expect weight to be measured in kilogram and creatinine to be measured in milligram per deciliter as is standard in the USA. Then हमारे पास पेशेंट अगर फीमेल है तो उन्होंने मेंशन किया है. Formula is useful because the calculations are simple and can often be performed without the aid of a calculator. Serum urea is produced in the liver and in the end product of the protein catabolism. Urea is freely filtered by the glomerulus and about 30 to 70% is reabsorbed in the nephron. Dehydration causes increased urea reabsorption. Therefore, the urea level increased during the dehydration, such as in the acute diarrhea, while the renal function is preserved and creatinine is normal. A normal urea to creatinine ratio is 20:1. This ratio is increased in the dehydration while the ratio remains same in the renal insufficiency. There are the other factors that affect the serum urea level as follows, which are increased serum urea independent of the GFR, which are dehydration, catabolic rate, high protein diet, glucocorticoids and tetracycline. जबकि जो हमारे पास सीरम डिक्रीज यूरिया है वो हमारे पास लीवर डिजीजेज, मेल न्यूट्रिशन, लो प्रोटीन डाइट और ओल्ड एज की वजह से होती है। तो बेसिकली आज हमने रीनल फंक्शंस वगैरह के बारे में देखा है। यहाँ तक अगर कोई भी इशू हो तो पूछ लीजिएगा। अल्लाह हाफिज़।